Ragadi-rogan sattan shaktan nateshakayan prasutan natesham ausatyamo janam yo apurva vejjaya namostu tasmai. Respected audience and the Biswajit Das. Biswajit Das I know very well for a long time, and he is MD PhD and had made lots of the work, and he is a renowned person, and he obliged my request to spare time and give some knowledge for the enthusiastic, practically oriented. So I welcome Dr. Biswajit. I bless you for your work which has been done. Today he is speaking about the Geriatrics. This was the word I used in 2008. Geriatrics is geriatrics. Here he is giving the emphasis over the gerontology and gerontology based diseases, how to be treated through the Panchakarma very specifically, and how they have to be, how the geriatric population has to be controlled. To be frank, we are very young Indians. The average age of Indian is 38.5 years only. But whereas the Japan and the China, the people are very older than that of, and average is said to be 46 or 45 years is the average age of the country in China and Japan. So the geriatrics is much more needed for the Chinese probably. I welcome once again Biswajit Das, and you are being co-host, and you can launch your PPT and you can start your lecture, sir. Please, welcome.
Thank you, sir. Shri Gurubhyo Namaha. My pranams to Lord Dhanvantari. Today, it is a very auspicious day, and I wholeheartedly. Yes, sir. Is it audible?
Hey, audible. Please make it full screen. PPT. Yeah.
So today my topic is practice of Panchakarma in Jara, that is geriatrics, and very rightly what sir has said, that is geriatrics. So here, coming to the introduction, that is, as already all we know and we have read in our Ayurvedic degree course, that Jara is one among the Ashtanga Ayurveda, as it is described all of our acharyas. So this Jara Avastha or old age is the last or the fourth stage of human life. So as the physiological functions get decreased, the same in this time, this individual has suffered a lot of pain, distress, sorrowness, and hardship and miserable conditions. So that is that of a body and of the mind. Here, old age is an ever mysterious period in the human being. So from the time of immortal, the people have been suffering a lot in this age. So keeping in these views, our great Adi Shankaracharya, he has described that Angam Galitam Palitam Undam Dasanam Vihinam Jatam Tundam Vriddhaho Yati Grihitva Dandam Tadapina Muncha Tasyati Pindam. So here in the verse number 6, he says, when the body has drained, hair turned white, and a toothless mouth, the old man walks supporting himself on a stick. Yet the meat of desire does not leave him. It is as mentioned by Acharya Adi Shankaracharya. Next slide. So next. So this is the Jara, what is already been described among the Ashtanga Ayurvedas. Next. So here our Panchakarma. Panchakarma therapy is been indicated or is described by our acharyas starting from the pediatrics to the geriatrics. So starting from the pediatrics, we can apply Panchakarma therapy, whether it is a Abhangam or Snehana or Rudusvedana or Vamana or Virechana, even if Basti, any of the therapies as per the condition demands, we can carry out the Panchakarma therapy in case of pediatrics, starting from the birth till the geriatrics, till the old age. This Panchakarma therapy can be carried out. It can be worked out for the preventive aspect as well as for the therapeutic or the treatment and the promotive aspect. Next. So coming to the geriatric specialties. So exactly what the geriatric specialty demands and says. Here the geriatric psychiatry or the psychogeriatrics is one of the branch where it deals with the dementia, the delirium, the depression and other psychiatric disorders. Another one is cardiogeriatrics, that is which focuses on the cardiac disease of the elderly persons. Same way, geriatric nephrology, which is in quite high demand, where we focuses on the disease of kidney. Another one is geriatric rehabilitation, which focuses on the physical therapy in the elderly or the old age persons. Another branch is also geriatric oncology, that is which focuses on the tumor in the elderly persons. The geriatric rheumatology is another emerging branch. Likewise, the geriatric diagnosis imaging, the geriatric dermatological department, the geriatric subspecialty in medical clinics and in other department. So now if we see, geriatric is been a very sub-minute branches have been developed. As such, when we talk about geriatrics in modern science, we have a very good geriatric department in Madras Medical College, in Amruta Vishwavidyapitham in Kerala, and also in AIIMS. Same way, whenever we are talking about the Ayurvedic geriatrics, we have a geriatric ward and department. It is functioning in Banaras Hindu University Faculty of Ayurveda and also in All India Institute of Ayurveda at New Delhi. Even if this geriatric campaign was started by the CCRS in the year 2008. Next slide. So here, what Panchakarma is and how it is going to help. The helping hand for preventing aging. Here, geriatric is the branch of medicine that is concerned with the problem of aging, including all aspects of aging with respect to physiological, pathological, psychological, economic, and sociological problems. The importance of geriatric is emphasized by the fact that the life expectancy is increasing as the medical science is progressing. According to a survey in 2050, India will have more than half of the population above 60 years. Next. Next, we come to aging as per Ayurveda. Here, Jara is considered as a Swabhava Vyadhi according to our Acharyas. Again, coming to the type, it is said Kalaja and Akalaja. That is of two types. Next, the Kalaja Jara cannot be prevented or cured as it is a normal process of body in which each and every system of the organ of body will undergo progressive declination of the functions. But when it is of abrupt onset, then it is surely associated with a disease or due to a yoga of Kala, Artha and Karma, so it can be corrected. That means Jara is a Swabhava Vikara or Swabhava Vyadhi, but some of the conditions are there which we can limit through the application of Panchakarma, whereas many of the conditions are there where it is self-limiting and some of the conditions are which are also achikitsya. Next. So coming to the pathophysiology, there is disturbances in the Sharirika dosa and Manasika. Here two parts has been made. First one coming to the Sharirika dosa, there will be the Agni Mandya. From Agni Mandya, it leads to the Rasa Dhatu Kshaya, and from there it goes to the Uttara Dhatu Kshaya. From there will be a Oja Kshaya and it leads to the Jaravastha. In case of the Manasika dosas, when there is Manavahasrata Dushti, then Apachana is there. From Apachana, there will be Ama will be there. From Ama, it leads to the free radicals. Then there is injury to the cells, and gradually there is damage to the organs, and it starts the aging. Next. So here, the common lakshanas what we find, these lakshanas are the general lakshanas which we found. These are the Sharira Shakti Kshinata, Krishata will be there, Dantahinata will be there, Palitya, then Smriti Nasha, Vatamaya, Jiva Kampa will be there, then Murdhapada Kampa. These are of neurological origin. Then of psychological, it is Sahasahinata. Then Chinta Bahulyata will be there. Then Ati Krodha and Klesa Asattva is seen. Same way for the respiratory system, the common lakshanas which we will find, those are the Kasa Swasa. Then Kafasya hi Gale means in Galama there will be the accumulation of Kapha. Nishtivanatasya, that is Gamana. Then Dhanu Vat Agrahasya and Dandasena Gamana. In the musculoskeletal system, the person will be find difficult to stand straight or erect. So usually whenever there is aging, the person's bends or the leans towards forward. It is usually seen. Next. So here, what is our target? So coming to the target, that is to give a proper lifestyle to the aged people. From the Ayurvedic science or from the Panchakarma, we will make some, definitely will help to have their proper lifestyle for this aged person. Then to delay the aging, to give preventive and curative measures to premature aging. Next, then we'll come to the 5I of geriatrics. That is what it is said. It is the immobility, incontinence, instability, intellectual impairment will be there, and iatrogenic disease. This 5I of geriatrics is very important, and This type of cases definitely we are going to find in our practice. Next, coming to the definition of aging. The accumulation of changes in an organism or object over time. That is, in human, it refers to a multidimensional process of physical, psychological, and social change that is characterized by the declining ability to respond to stress. Increasing homeostasis imbalance will be there, and increased risk of the disease. Next, the facts and the figures. What the fact says, that is, the world population, those who are aged over 20 years, that is in the year 2000 it was up to 600 billion, in 2015 it was 1.2 billion, whereas for the coming year 2050 it will be just double, that is up to 2 billion. So here is the data, that is of 1951 it was of 3.6%, in 1981 it was 6.1%, in 2000 it was 9.1%. Here the total population above 60 years of age, what the statistics data says, that is in 81 it was 43.1 million in India, in 1991 it was 56.7 million, whereas in the coming year, that is in 2025, it is expected to be 76 million. Next. So why do we need to know this aging? Exactly to say, that is the difference between the physiological and the pathological phenomena in the geriatric population. Nowadays, we find a lot of elderly persons or lot of retired persons nearby us, those who are and comes under the elderly population. To appreciate the impact of normal age related degeneration on the disease and their management. So we should know the process of aging. Next. Then how to assess? So for this thing, we have a CGA, that is in short form, otherwise it is known as a comprehensive geriatric assessment. In that, the nutrition, the pulse, the erect and supine, BP, the hearing, vision, the cognitive functions, the muscle, then per rectum, the joints and gait balance. All these things we have to access. Next, coming to the some common health problems in the elderly persons. So as the commonly health problems, what we find, those are the hypertension, the decreased resistance, the respiratory disorders, the neurological problems. Usually we find constipation, the renal problems, then osteoporosis, then prostate complaints is a must for the male population. Then mental disturbances, insomnia, sleeplessness is very frequent and quite common among the elderly population. Then is the cardiac problems. So next, this is how we will execute. So what Ayurveda says, Ayurveda science being fundamentally the science of life and even if the science of longevity. So it seems to have addressed these issues in an unique and a holistic manner, involving not merely the biological care, rather also encompassing the psychosocial and the spiritual dimensions. So here there are strong possibilities to develop a safe and cost-effective package for the geriatric care on the basis of Panchakarma. Here there is Dhatu Shithilata or Dhatu Shaithilya and Ojakshaya are the key events of the Vardhakya. Then Snehana and the Swedana are the wonderful tools for this Bala and Pushti. The Sneha maintains the Sara of all Dhatus. Next. Here, the basic approach is Agni Karana and Vatanulomana. Vatanulomana is being the first line of treatment. So both these are possible through the Snehana and through the Swedana. Sneha is the best for the Durbala type of person or in case of the elderly. In old age, due to the Vata domination, Vishamagni and Krura Costa may coexist. So that's why Mrudu Snehana or the Snehana is the best choice for the treatment. Next slide. So here we'll come to the Panchakarma. Exactly what Panchakarma is and what type of Panchakarma therapies we are going to make on the elderly persons. So here Panchakarma is basically a special therapeutic procedure that is popularly practiced for the biopurification of the body, which is having also rejuvenating effect. That is the composite nomenclature of the 5 kinds of therapeutics designed for transmembrane or the visceral and cellular purification, as well as the transdermal purification of the body. So essential, the therapeutic technology, that is the Vamana and Virechana, can rightly be said as Shamsodhana procedures. Next, we will come to the scope of this Shodhana therapy. So what are the scope? Grossly, it is divided into 4 parts. That is, first one is the promotive or the preventive care, to promote the health of a healthy and to tackle the 3 dosha rhythms in different seasons. That's why it is already said that Ritu Anusara Sodhana or Ritu Anusara Panchakarma can be practiced for the aged persons. Next is rejuvenative healthcare. So the rejuvenative healthcare, it is an integral prerequisite for the Rasayana therapy and the Kaya Kalpa. Third is the curative management, that is for different type of condition or different type of disease can be eradicated by the cleansing procedure, that is the Panchakarma therapy, and the disease channels in the chronic disease it can be carried out. Mostly the type of basti or the matra basti, shira basti, this type of chikitsa can be carried out as the curative management. Next, the rehabilitative healthcare. For the rehabilitation, that is to suppress the disease process and to rehabilitate the patients. That is mostly after the traumatic injury or the accidental injury, we find a lot of scope for the rehabilitation. Even if with Panchakarma, this physiotherapy is also going to help a lot. Next. So here, coming to the Indian scenario, that is in India demographic, it says the elderly population is around 82 million, whereas the Indian elderly population is expected for the year 2025, it will be up to 177 million. So a nation gets labeled as aging when the 60 plus age group in its population crosses by 7%. So India has earned such distinction of rank nation with about 7.7% of older population. That means in India, the geriatric population is increasing day by day. Next. So here we'll come to the Ayurveda perspective. That is this Jara Avastha. It is an irreversible condition that can only be stabilized or prevented and not to be cured. Anyway, some of the disease conditions are there which can also be cured by the Rasayana or the Panchakarma therapy, and even if with the Shamana Chikitsa. So management of this Jara can be carried out by the Rasayana Chikitsa indicated. So first comes here the Snehana or the Abhyantara Snehana, another one is the Bahya. So here coming to the Abhyantara, the internal type, the Vicharana Sneha or the Sadhya Sneha, which is mentioned in the classics, are more relevant, whereas Achapana or the Suddha Sneha or the Kevala Sneha is little bit difficult to practice. So the Murchita Sneha is quite easy for digestion and also for absorption. That means it can be easily practiced for the elderly persons. The Sneha Pravicharana, like the Kanji, Krishara, Yusha, Yavagu, etc., can be given and also can be widely practiced by the Ayurveda physicians. In post-menopausal syndrome, that is the Pittavrita Vata Chikitsa, which includes the Jivanya Gritapana. That type of Grita can be also be prescribed and can be given to the aged persons. Next. Coming to the Bahya type of Snehana or the external, in case of the external Snehana, that is the Mahasneha, can be very well be practiced in case of the Asti Majjagata Vikaras and also the deep-seated pathologies. Same way, the Abhyanga purposes or can be practiced in for the Shakhagata Rogas or the Vikaras. The Murdhni Taila in case of the Madhyama Roga and sensory impairment or the Indriya Prasadana, it works good and is said to be fruitful. Next, the Karna Purana. Karna Purana in case of the ear disease, the Kaya Sekam for the Dhatu Drudhata can be carried out. Same way, the Padabhyanga in diabetic care and also in case of the eye care, it is to be widely prescribed and it can be practiced. Bandhana, that is Bandhana with the Vasa and Majja type of Sneha in case of the Buddha Bhransa and Yoni Bhansa. As prolapse of this rectum is widely found in our OPD level practice. Next. So coming to the Swedana part. Anyway, Mrudu Swedana can be practiced very easily. That also, this Swedana will act as the Vedana Shamaka. Then Swedana is then very good tool for the Vata Kaphaja stage or the Vata Kaphaja Vikaras. Swedana is good for the Stamba, Gaurava and Shula. In case of any type of pain, we can apply the Swedana procedures that which have been said. The type of Abagaha Sweda for the cases of Arsha, Katishula and Asmari can be prescribed. Next, the Sweda for the Vata Prakopa with Dhatu Shaya also can be done. Different type of Drava Sweda are described by our Acharyas. The symptoms which are associated with the Daha and Pitta dosha all can be prescribed and can be very well practiced with the Drava type of Sweda. This Anagneya Sweda can be practiced in the case of Madhumeha or the diabetes mellitus, Stolya and in Kapha Medaja state. Here one thing is that we should avoid the Agneya type of Sweda for the Prameha or the Madhumehis. Different type of Annalepa or Navara can be carried out in the case of emaciation or in the Purusa type of person. Then for Tvak related and for Brahmana purpose also, we can practice this Annalepa type of Sweda. Next. Next is coming to the Upanaha Sweda. Whether it is Agneya, that is Saagni or Niragni, both type of Upanaha Sweda can be practiced in case of the elderly persons. Different type of swellings in case of Amavatas also, we can carry out this Upanaha Sweda. As already different acharyas, they have mentioned about the Salvana Upanaha and Upanaha with the Upanaha churnas readily available, we can practice over our elderly persons. Swedana can be carried out in the soft tissue, that is for the rheumatism, as well as in the cases of Ababahuka, etc. So Abagaha Sweda is a very good type of Sweda for gastrointestinal conditions. Next. Then some common problems that which will help through Panchakarma therapy. So first one, coming to the musculoskeletal system. That is Sandhigata Vata. Different massages, different type of massages with different oils can be carried out according to the conditions. Then Swedana, the Swedana we can do are different types of Swedanas are there. Even the Sankara type of Sweda or the Potli Sweda are usually practiced in case of the geriatric patients. Tikta Kshira Basti, Madhutailika Basti, then Rasayana therapy can be carried out, whichever is found suitable for the patients according to the Yukta of the Vaidya. Next. The Jambira Pinda Sweda, Patra Pinda Sweda, then Arka Patra Sweda. These type of Swedas are usually can be practiced in the case of the elderly persons. Then the Basti according to the state of disease. Next. That is the case of Manyastamba. In Manyastamba, we can carry out the Griba Basti, even if the Griba Pichu, the Nasya. Then another one important thing is that Uttara Bhaktika Snehapana. It can also be prescribed for the case of Manyastamba. Next, coming to the Trikasula or the Katishula Katigraha. Usually this low back ache and type of IVDP, such type of conditions are also frequently we are finding in our OPDs. So for them, the treatment we can carry out, that is Abhyanga with different medicated oil according to the conditions. Then Jambira Pinda Sweda, Patra Pinda Sweda, Arka Pinda Sweda, this type of Swedanas can be practiced. With that, the Mrudu type of Bastis, like the Madhutailika Basti, also Yoga Basti for that is for 8 days, then Matra Basti, Kati Basti, that is the external Basti, and Kati Pichu, even if Kati Dhara, such type of treatments can be carried out. Even if also the condition demand, we can also go for the Vaitarana Basti for 7 or 8 days. Then Virechana, that is Sadhya Virechana also we can practice, and also Mrudu type of Virechana or Nitya Virechana. That also we can practice for the conditions of the Kati Shula. Next. Another condition which we find in our OPDs, we'll find that is the muscle weakness or the muscle stiffness. So for this case, usually this Navara Tepu or the Shashtika Sali Pinda Sweda or Kaya Seka, these are usually to have very fruitful. So usually it is to be carried out for 30 to 60 minutes. That is, it can be done for 7 days, 14 days, also up to 21 days we can carry out. Another thing is that some pain in the heel, that condition of Vata Kantaka, what we say, that is calcaneal spur. For that also we can give the treatment of Tiktaka Kshirabasti can be given, Upanaha Sweda can be done, also the Agni Karma can be carried out. Next. Then another important condition which we find, that is an Alzheimer's disease. For the Alzheimer's, that is we can compare it with the Vata Prakopa, that is mainly of the Prana and Udana Vayu, and Smruti Nasa is usually seen. For that condition, usually Mastiska is found to be very important. We can do the Talam, Abhyangam with different oils, also with the Grita we can do, Swedana procedures, Virechana, Nasya with different Tailas, with different yogas can be carried out. Then another thing is that Takradhara. Takradhara is found to be very fruitful. Then Shirodhara. Shirodhara usually with any Medhya type of oil. It may be Brahmi Taila, also Dhanvantaram, and different oil also can be used depending on the condition. Then Shirolepa, the Talapotichil also can be carried out. Next. Kampavata or the Parkinson's. So here mainly it is Vata aggravated or Vata affected condition, that is of the Prana Vayu, Udana and Vyanagata Vata involvement is there. There is Chalaguna Vriddhi is there. So usually there will be tremor, bradykinesia and rigidity is usually seen. For such type of conditions, it can be managed with the Talam. Talam can be given with the different types of oil mixed with churnas can be carried out, or also even if with takra also we can practice. Mostly in our hospital, we are using Rasnadi Churnam, Kachuradi Churnam, such type, or Panchagandha Churna, this type of we are using. Then massage with different medicated oils according to the conditions. Kaya Sekam is very fruitful for this Parkinson's. Also, Yapana Basti, that is Mustadi Raja Yapana Basti, is we are practicing. Then Shirodhara, mostly with Mahisa Kshira or Go Kshira or different type of Jatamansi Siddha Kshira we are using for the conditions of Kampavata. Siro Pichu also we are doing. Then Sirobasti. Sirobasti we are doing for 7 days, up to 14 days also we are doing. Then different type of nasyas also we are carried out, and very good result is seen with the nasya procedure. Next. So this MND or motor neuron disease, that is can be said as kapha-bhrita vata. So here muscle wasting, vacillation, weakness and dysarthria etc. are usually seen. So the treatment what we do, the rukshana is a must. Udvartana can be carried out. It can be done with Triphala Churna or Kodakulathadi Churna can be taken. Then Snehapana, usually the Snehapana, Brahmani type of Sneha we are using, that is the Rasna Dasamula type of Gruta can be given. Then Virachana is usually carried out with the Snehi type of Virachana is carried out, that is with Eranda Taila. Also with Tribrut Leha also we are conducting. Then the Patrapinda Sweda also carried out. Then coming to the case of the Pakshaghata. For Pakshaghata and related with Ardita, Talam, then Abhyangam with different medicated oils can be carried out. Swedana, that is one Panasapatra Sweda. Frequently we are practicing for the Ardita or Bell's palsy cases, and we are getting very good result for the Panasapatra Sweda. Then Virechana also we are doing. Nasyam is being done. Then Shira Dhuma, it is a very good procedure and Kerala Panchakarma which we are practicing for this Bell's palsy condition. And Siro Basti, Basti Niruha Basti and Anuvasana Basti, that is of 8 days, 16 days we are doing in our hospital. Next. Coming to the Anidra. So this condition where there is Kapha Kshaya is there and Vata Vriddhi is also there. So Anidra is found. So the treatment are usually with the Nasya, Takradhara, Vamanam can be carried out, Snehana, Swedana, Talam and Shirodhara, also Siropichu are found to be beneficial for the case of Anidra. In that Panchagavya Grita, Kalyanakam and Brahmi Grita can be given in Samana Matra, also the Nasya can also be given. Next. For this different types of Vata, in case of the Sandhi Vata and Asti Sausiria type of conditions where there is Vata Vriddhi and Kapha Kshaya is there, it can be managed with different type of Snehanas and Swedanas. So mostly Madhuyastyadi Tailam is given in case of the chronic arthritis issues. Then also even if there is Raktaja involvement, that also we are doing. And this Tiktaka Kshira Basti is usually with the drip method we are practicing in our hospital, and it is giving very good result. Next. The condition of the cervical myelopathy. Usually most of the cases in from modern side, there is no so much of result for this case of cervical myelopathy. Most of the cases they are preferring Ayurveda treatment. For them, we are making the protocol of this Talam, then Griva Pichu, then Swedana, then Jambira Pinda type of Sweda, then Virechanam and Nasya. This is what protocol we are following in our hospital. Next. So now coming to the condition of the gastrointestinal system of the GI system. In coming to the GI system, mostly constipation is the found in all maximum of the cases, and usually it is associated with the adhvana. So usually for them we are practicing matra basti, 70 to 75 ml of matra basti, which we are practicing for up to 15 days or up to 21 days we are giving. And simple anulomana, that is Gandharvastha Kasam, is been prescribed. With that, different churnas are also we are prescribing in our hospital. Next. Then bowel incontinence. For this particular bowel incontinence cases, and those who are usually the patients who are bedridden, for that conditions also we are conducting this Avagaha Sweda, then local or the Stanika Pichu, then Sneha Bana, then Matravasti is found to be beneficial. Next, coming to the respiratory system. So different conditions are there. That is, first one is the Swasakasa or the chest congestion. Such type of case, we are conducting the Nadi Sweda and Snehana with the Lavana Taila. Then Virechana and Rasayana Prayog also we are doing. Next. Then is sinusitis. That is, for the sinusitis, the Abhyanga is carried out or done over the whole face, and Nadi type of Swedana is usually carried out, and Nasya we are doing. So with that, some Samana Oshadhis are to be given, and usually the treatment which protocol we are conducting, that is, we are doing the treatment for up to 1 month. Then only the patient will get some relief. Next. Next, coming to the genito-urinary system. So usually many cases are coming with the erectile dysfunctions. So for them, we can practice Vrishavasti. Also our classic says for the Uttaravasti. Then for the urinary incontinence, Abapidaka type of Snehapana. That is, the Sneha is to be given just before the food and just after the food. Usually such type of Snehapana is found to be very effective. And Avagaha Swedam also we are doing with the Dasamula Jala, and also even if also Kshira. Different types of milk also we are using for this Avagaha Sweda. Then Virechana and Uttaravasti are to be done. Next, coming to the BPH. For BPH, we are protocol which we are following, that is the Snehapana. Then Swedana or simple hot water bag fermentation also we are advising to our patients. Then Virechana, Niruhavasti, and if possible also Uttaravasti we are practicing. Next. So here comes the dementia. For dementia, all types of Mastiskya karma is been described by our acharyas. So the Shirobasti, Shiroseka, Shiropichu, Shirolepa, and Talapudichin. All this can be carried out. With that Mastiskya karma, different Rasayana therapy and different Medhya type of Rasayana can be given. Next. So coming to the Abhyanga part. Here is the Abhyanga is the external oleation, which is very widely practiced in all of the Ayurveda hospital in our country. So why Abhyanga? Here comes because it permits the transfer of heat and vital energy. So Abhyanga is the best line of treatment and is the first choice of treatment for the geriatric persons. It renders the body compact and well formed, accelerates blood circulation, and also gives a very good oxygen supply to the entire body. So here one thing I want to highlight and focus, Abhyanga is definitely, whether it is the classical or it is a local type of Abhyanga, definitely Abhyanga is going to help the persons, with the elderly persons. So only the thing is that we have to select the type of Sneha which we are going to use, and in which condition and which type of particular, whether we are going for the Eka Stanika Abhyanga or local, or whether Sarvadahika. By knowing that, we can carry out the procedures. It may be indoor or it may be OPD level. So Abhyanga is quite easy to practice, and definitely it is going to give very good result to the elderly persons. It also promotes here elasticity and functional ability of the nerves, tendons, and muscles, affording softness of the body. So it prevents stiffness and sclerosis of the blood vessels. So next comes here the guidelines for choosing the direction, the duration, the force, and pressure application for this Abhyanga or the Ayurvedic massage therapy. Here, in relation to the heart and the circulation, it is carried out. In relation to the origin and insertion of the muscles, then of the lymphatic flow and the vital parts, joints, abdomen of the eyes. Another thing is that here I would like to focus this American Massage Therapy Association, AMTA. Usually they are conducting this massage for those elderly persons, and they have found a improvement of 70.77% in all of their cases, all of their geriatric cases, those who are subjected to massage. So in Ayurvedic massage therapy also is going to give very good result. So for all of the cases, Abhyanga is a must for the elderly persons. Next. So coming to the discussion part. So here the discussion is that more than half of the adults, that is of the age more than 65 years, are having 3 or more medical problems. So such the conditions are having either the heart disease, the diabetes, the hypertension, Alzheimer's disease, or with the arthritis. So prescribing medications for a patient with multiple health problems is definitely very complex. Next. So some contraindications are there for the Panchakarma therapy for the elderly persons. Those are the persons with HIV, AIDS, even if the tuberculosis and morbid obesity, and most emaciated persons, and very highly hypertensive persons, then cognitive heart disease, anemia, then active infections and open lesions, cancer of the skin, the lungs, of the testicles, then of the limbs. So into the persons who are in intense grief, for those conditions, even if it is also contraindicated, we can carry out the therapies as and when required, but it should be under the supervision of an Ayurvedic physician. So in these cases, this palliation of the dosha precedes the Panchakarma therapy. Next. So during these 3 pages of Panchakarma, the restriction which one should observe, that what we should advise to the patients, that are to avoid the cold exposures, that the maximum person they should avoid the remaining or staying in the AC for a long time, then to avoid sex, the loud noise, then some bad news, stress, then avoid the divasopna, the day sleep, then they can rest as and when required or when they are tired, but avoid the suppression of natural urges, sneezing, coughing, etc. Then late night awake is also to be avoided. Then avoidance of indigestible food, that is the favored foods that balance the doshas. Then avoid the strenuous exercise, that is restorative yoga in moderation at the right time can be found okay, and it can be prescribed. Next. So this is the sequence. What is this? That is the coming starting from the Pachana, Dipana, then Rukshana. These are the prerequisite. Also the Snehana and Svedana are the Purva Karma. Svedana, the Sodhana Karma is very sparsely or very less. We are practicing the classical type of Vamana, Virechana, Basti. Usually the Mrudu type of Vamana, Virechana, Basti, or the Rakta Mokshana, like Jaloka type of Rakta Mokshana we can practice. Then the Peyadi Samsarjana Krama can be done if the patient is subjected to the Shodhana Karma. Next. So this is the Panchakarma therapy, what we are going to do over the patients and subjected if the patient is fit for the therapy. Next. So next comes how these therapies are going to help. So here the classic says that Indriya Mana Buddhi, that it is said Prasidhati, then Bala Buddhi Pushti Rape Brusata Chasya Jayate Jen Jara Kruchena Labhate Chiram Jivatya namayah tasmat sansodhanam kale ityuktam vive naraha. Next, what it indicates that depending on the conditions, we can carry out different types of Panchakarma therapy. Also for the preventive of aging also we can do. Also for the curative of the disease. Even if for the rejuvenative purpose also, some therapies can be carried out. Next. So these are the list of the references. Then at last I would like to say, help me to walk. Help me to end my life with love and patience. The only thing that I need from you is a smile and a lot of love. Thank you one and all. Jai Dhanvantari. And I would like to thank Professor Dr. K. Sivaram Prasad for giving me this an opportunity and share my idea and my things what we are practicing for the case of the old age persons. Thank you one and all.
Thank you very much, sir. Das, and it was very comfortable to hear. And in fact, I just wish to tell my ideology also. Whenever we are trying to go with the Techno-Ayurveda, we would like to go with the more of the scientific analysis, but suddenly a break is came and a traditional Ayurveda has been focused by you. And I'm very much thankful. If at all there are any questions related, experience based, because Das is practical oriented and conceptually sound enough, so that you can ask the both ways, conceptually oriented, practically oriented questions, if at all you have anything in your thoughts or mind. It is open.
Anyway, here I would like to add also some things. Even if they can ask the questions. Here one thing is that as many of the Ayurveda physicians are there and almost all are the practitioners, definitely I would like to add that this geriatric is having a very wide scope. For Ayurvedic geriatric, we are having a very wide scope, and definitely we are going to get a very lot of practical knowledge from our practice. So hope this geriatric practice will help our physicians to practice in their state as well as in abroad also. And Ayurvedic geriatric field is an emerging field, and also another field is the sports medicine. The sports medicine and in geriatrics, both of our emerging branch, and hope our young physicians, they will be practicing the days to come.
Thank you. I think there are no questions at present. Thank you, Dr. Das, and may God bless you. And today we close here. Thank you very much.
Thank you.